Dear colleagues, dear participants, welcome to WHO UNFPA webinar, Strengthening Integration of Sexual and Reproductive Health in National Universal Health Coverage Plans and Processes in Eastern Europe and Central Asia. Before we start the webinar, we'd like to announce some important information for all participants. First of all, the webinar will be conducted in English. Translation into Russian is provided. Please kindly click a little globe on the bottom of the page and switch to Russian channel if you wish to follow the webinar in Russian. For any questions, any comments, please use the chat box. You see the chat box sign also on the bottom of this page. Also, please submit your questions or answers in the box, which is Q&A. You see it also on the screen. Please kindly note that the session will be recorded and posted on the WHRP YouTube channel later. And we know that by registering, you have provided your consent to participate in today's webinar. So the information provided may be used for anonymously to inform future consultations and publications. And last but not least, please keep your microphones on mute when you are not speaking. Thank you very much. Before we start, I'd like to introduce the program of the day. We have welcome speeches from WHO and UNFPA. We have our remarks from Deputy Minister of Health of North Macedonia, Dr. Jovica Androvski. We have country presentations from North Macedonia and Kazakhstan. And also, most importantly, we'll have the tools and practical guidance of WHO to be presented by Volosny Govender. Before the end of the webinar, we'll conduct the poll to get your feedback, and we'll have the questions and answers session. Thank you very much. Before we start, I'd like to give floor to, I'd like to also provide some objectives of the webinar. As you know, we have three key objectives: to share the country experiences from ECA countries on achievements and challenges related to integrating SRHR within the Universal Health Agenda, to present a summary of WHO essential tools and publications, while offering practical guidance on their utilization, and to identify ways in which WHO and UNFPA can provide technical leadership to countries in positioning SRHR as part of UHC. So without further information provision, I'd like to give a floor for opening remarks to our dear colleagues, Dr. Natasha Azoparty-Muscat, the Director of Division of Country Health Policies and Systems at WHO Regional Office in Europe. Natasha, thank you very much for joining. Thank you very much for your support. The floor is yours.
Good morning, everyone. Thank you very much, Tamar. Good morning, colleagues, friends, ladies and gentlemen. And I joined Tamar in welcoming you to today's webinar, which we are jointly organizing. And I would like to begin by extending my heartfelt thanks to the UNFPA Regional Office for ECA for your steadfast partnership and collaboration. The work that we are doing together is clearly more urgent than ever before, especially in the face of increasing pushback on rights and choices, a deeply concerning trend. Our focus today is rightly on strengthening the integration of sexual and reproductive health services into national plans and processes for universal health coverage. Access to these services throughout a woman's life is essential for health and well-being, yet the barriers remain staggering. Shockingly, 4.3 billion people globally, most of them women, will not be able to access at least one essential intervention for sexual and reproductive health over the course of their lives. Sadly, this reality resonates strongly in our region too. And the reasons behind the sobering statistic are many. Insufficient funding, but more worryingly, restrictive laws, entrenched norms and stereotypes, persistent inequalities, and health system capacity constraints, also including inadequate recognition and integration of basic sexual and reproductive health services into health benefit packages. And as we discuss this topic today, we must also not shy away from addressing its critical links to other issues. And here particularly, let me talk about gender-based violence, which remains a pervasive barrier. It exacerbates health inequities and particularly undermines women's autonomy and safety. And of course, at the moment, we are conducting the 16 Day Against Violence campaign. And any comprehensive approach to sexual and reproductive health and rights must integrate strategies to prevent and address violence, and also ensure that survivors receive the care and support they need. And this is where there is a clear role for our health care systems. Equally importantly is trust. Trust is the foundation of healthcare access. Without trust in healthcare providers, systems, and policies, individuals may avoid seeking care, particularly for sensitive conditions. Building trust requires us to prioritize dignity and confidentiality in all aspects of service delivery. In WHO Euro's new framework on health systems resilience, we emphasize that resilience is not about only responding and managing to health crises and other crises, but also about ensuring continuity of essential services, including sexual and reproductive health, during times of stability and upheaval. And again, sadly, when we look at our region and also slightly beyond our region, we see that conflict characterizes the situation in certain countries. We must also confront the demographic realities facing the European region, the fact that for the first time there are more people aged over 65 than under 15 across the entire European region. These plunging fertility rates are a significant concern, but we cannot allow this to become an excuse for the erosion of rights or a justification for pushback on gender equality and sexual and reproductive health and rights. Instead, we must take this as an opportunity to ensure that our young people, women and men alike, are empowered to determine and control when and with whom they want to have children. Colleagues, let me now move to the reason behind our gathering today, the link to universal health coverage, which we commemorate this week. The answer is clear. When we talk about universal access to health services, we must include sexual and reproductive health services, ensuring that everyone, everywhere, can access such services is not only a moral imperative, but also a very practical necessity for bettering our health outcomes for all. Many health services can be effectively delivered through quality primary health care, But also we must recognize that women's health goes beyond reproductive health, and allow me here to shine a spotlight also on psychosocial health and well-being. And in fact, women and girls are calling for an approach that addresses both their physical and mental health needs from childhood through adolescence, reproductive years, and beyond. So, dear colleagues, let us not underestimate that the challenges we face today are real. The dilution or outright reversal of policies, along with the growing resistance to comprehensive sexuality education, threatens our progress in Europe and undermines our progress towards safeguarding health as a basic human right. And therefore, as we approach Universal Health Coverage Day, this year's campaign reminds us that governments have a key responsibility to protect and promote health for all. And in doing so, they must also ensure that sexual and reproductive health is central to their efforts. As we work together towards our shared objectives under the 2030 Agenda for Sustainable Development, the forthcoming European Programme of Work, and our ambitions to continue to strengthen universal health coverage, let us reaffirm that working in the area of sexual and reproductive health and rights is not optional, but fundamental. Thank you.
Thank you very much, Natasha. Thank you. We really appreciate excellent remarks and excellent points you raised. Thank you very much. Colleagues, it's my pleasure to welcome you on behalf of UNFPA Regional Office for Eastern Europe and Central Asia to this joint webinar, which, as you know, is marking the International Day of Universal Health Coverage, which we celebrate on December 12th. This webinar is one more step in accelerating the universal access to sexual reproductive health in our region, which is the target of the Sustainable Development Agenda 2030. 30 years ago, at the International Conference on Population Development, ICPD, the governments adopted the Programme of Action, agreeing to deliver universal access to sexual reproductive health. In 2019, at the Global Summit in Nairobi, the world community made strong commitments and agreed on visionary agenda to accelerate this progress, with a stronger focus on universal health, universal access to sexual reproductive health as part of the Universal Health Coverage, UHC. In spite of progress achieved, the countries and territories in Eastern Europe and Central Asia face significant challenges to achieve this target. We are glad that universal health coverage is in the center of our joint programs with WHO at the regional, global, and field levels. The joint workshop conducted in September 2024 for Western Balkan countries delivered impact-oriented action plans to accelerate the integration of the SRHR in the universal health coverage policies and plans at the national level. The workshops for Central Asia and South Caucasus are planned in 2025. We believe that joint efforts of both organizations will help the governments to make evidence-based decisions to increase the investments and to expand the universal health coverage towards sexual and reproductive health and rights. The focus on UHC is critical, especially now, when UNFPA and WHO regional offices are starting the preparations of the new programs, and 12 countries in Eastern Europe and Central Asia are preparing new UNFPA country programs. I would like to take this opportunity and to express our gratitude to WHO Europe, WHO HRP program colleagues, and WHO and UNFPA staff from the field offices for their active participation and cooperation in this important initiative, which we believe will elaborate impact-oriented, comprehensive, innovative approaches to the challenges faced by countries in Eastern Europe and Central Asia. Delivering the integrated SRHR service package is cost-effective and affordable for most countries, though some will require increased national budgets to successfully adopt and progressively realize SRHR in UHC. This increase in budgets should not be considered as the increased expenditures, but should be understood as the investments with return in health, development, and human capital. We believe our joint efforts will accelerate the progress in Eastern Europe and Central Asian countries. Thank you very much. Now it's my pleasure to give a floor to Dr. Jovica Androvski, Deputy Minister of Health, North Macedonia. As I mentioned, we conducted excellent joint workshop for Western Balkan countries, and Skopje hosted this excellent workshop. Again, many thanks to government, to UNFPA and WHO country offices for hosting the workshop and for conducting it at a highest level. The floor is yours, Deputy Minister.
Thank you. Почитувани колеги, соработници, почитувани представници од Фондот за население на Обединетите нации, UNFPA и Светската здравствена организација, ми представува особена чест и задоволство да ви се обратам во име на Министерството за здравство на Република Македонија на овој настан за одбележување на 10 декември, денот кога истакнуваме важноста на универзалната здравствена покриеност. Обезбедувањето на универзална здравствена покриеност и особено интегрирањето на сексуалното и репродуктивното здравје права е од исклучително значење за Република Македонија, но и за населението во регионот на Западен Балкан воопшто. Токму затоа сме особено горди што пред неколку месеци нашата држава беше домаќин на регионален настан во Скопје, на кој заеднички со представници на здравствените власти од Западен Балкан, UNFPA и Светската здравствена организација дискутиравме и развивавме планови за интегрирање на сексуалното и репродуктивното здравје и права во универзалната здравствена покриеност, за чија имплементација ќе продолжиме посветено да работиме. Реализацијата на целите за одржив развој, конкретно цел 3, здравје за сите, која е наша обврска, директно зависи од постигнувањето на универзалната здравствена покриеност, која што не можеме да ја постигнеме доколку сексуалното и репродуктивното здравје не се соодветно вклучени. Овие напори и инвестиции водат кон унапредување на здравјето на населението, што е клучен предуслов за напредок и развој на едно општество, и токму затоа и во програмата на нашата влада луѓето се во центарот на нашето делување. Не можеме да зборуваме за човекови права, за напредок и универзална здравствена покриеност, ако услугите за сексуално и репродуктивно здравје не се достапни, прифатливи и со соодветен квалитет за секој поединец, особено за лицата кои се соочуваат со дополнителни потешкоти од различен карактер. Верувам дека денешните дискусии и алатките за мапирање на постоечките услуги за сексуално и репродуктивно здравје, но и на услугите кои не достигаат, ќе бидат од особена корист за унапредувањето на сексуалното и репродуктивното здравје на нашето население и креирање на политики, програми и буџети соодветни на потребите за секој поединец. Сакам да искористам оваа прилика и да се заблагодарам на Светската здравствена организација и Фондот за население на Обединетите нации, UNFPA, за конструктивната соработка и несебичната поддршка која ни ја пружаат кај нас, но и во регионот на Западен Балкан воопшто. Верувам дека со посветеност, професионалност и континуирани заеднички напори ќе успееме да го напредиме сексуалното и репродуктивното здравје на нашето население, при тоа почитувајќи го достоинството и човековите права на секој поединец. Ви благодарам. Thank you.
Thank you very much, Dr. Androvski. We congratulate North Macedonia with significant achievements and count on support of the government in our future initiatives. We believe we'll achieve a lot together. Thank you very much. Colleagues, I'd like to give a floor to North Macedonia country office to talk about the experiences, achievements, and priorities. And it's my pleasure to give floor to Ms. Jovanka Prajovic-Grigorjevic from UNFPA country office. Jovanka, the floor is yours.
Thank you, dear Tamar, dear WHO team. We have prepared one slide just to guide our discussion. In principle, what we would like to share is the experience of North Macedonia with regards to advancing cervical cancer prevention. And in particular, we're happy to know that this significant change came at a time which was unprecedented with the onset of the COVID crisis and the restructuring of the health system to prioritize the needs of COVID patients. We've seen many challenges, many cuts in terms of availability of SRHR services or reorganization of the health facilities, which led to some difficulties for people to reach SRH services. Just to give you an idea, as per the statistics, we do have enough obstetricians, gynecologists in North Macedonia, similar to the European countries, but the distribution of these services is very uneven. And some regions, rural, are really underserved, and this comes out as a finding in different studies and researches that are done over the past years. So the experience of North Macedonia that we would like to share is basically how we approached the challenge to ensure continuity in life-saving essential SRHR services during times of COVID, which later on, gradually in close collaboration with the Ministry of Health and all other relevant partners, turned out to be a good model and was successfully integrated in the national health system and the national budget. In response to the COVID crisis, jointly with WHO and UNICEF, we mobilized and secured funding to provide services in times of COVID for the most vulnerable. And in particular, I would highlight the access to services through mobile gynecological clinics. Of course, UNFPA could not do this by ourselves. This was done in partnership also with the civil society actors who do have contacts with the population on the ground, so that we secure good preparatory work ahead of the visit of the clinics is done, and that the services are used to the fullest. The Red Cross of North Macedonia, as I said, was one of the key partners, but also the Association of Gynecologists and Obstetricians. This effort really proved to be valuable and appreciated by the population, and we went even a step further to offer these services to other women and girls that even pre-COVID had some challenges to access SRHR services, such as women serving a sentence in prison, or vulnerable women, drug users, or engaged in sex work. So really those who were furthest behind. The process was done with parallel engagements and work with the eHealth Directorate. And we worked on advancing the system for registration for cervical cancer screening. So not only, as I said, the clinics were out in the field providing SRHR services, but in parallel, we worked to make sure that these services are integrated in the eHealth Directorate, and also at the same time to advance the cervical cancer screening registration. What you see on the screen is actually the website of North Macedonia, which now provides also screening digital registration for mammography, not only for cervical cancer screening, but it's going even one step beyond. This was done, as I said, in parallel, and with the following 1-2 years of project implementation, and then after the ending of the project, the model which was developed and which proved to be really yielding results was also recognized by the Ministry of Health. And the Ministry of Health decided to integrate these mobile gynecological clinics, which had been actually procured as a response to the refugee migrant crisis back in 2015-16 by UNFPA. So now they finally became a unit, organizational unit within the University Clinic of Gynecology and Obstetrics. So these are fully integrated and continue to run even nowadays post-COVID. And now they are fully, primarily, not fully, but primarily focused on providing cervical cancer screening services to underserved areas. The good thing is that thanks to the digitalization and the full integration in the national health system, the doctors, when they go out in the field and provide the services, can easily refer patients to other units or specialized facilities for additional follow-up. And the record for the patient is stored in line with the national legislation to protect the privacy and also to allow for easy medical follow-up. In parallel with the advancements of the cervical cancer screening, with the digitalization and the engagement of the clinics, I would like to highlight that over the past 3 years, and we really commend the Ministry of Health for increasing the budgets for cervical cancer screening. And we see through the numbers of women screened almost 7-fold increase in the number of women screened in 2023 compared to pre-COVID, or even compared to 2021. This year, we expect even to see even a more significant increase, because what was the result in December 2023? In 2024, these numbers have already been reached in June. So we really see that the approach is giving results. In parallel, there has been a lot of advocacy with the health authorities to scale up the HPV vaccination, which, although introduced in North Macedonia in 2008, and almost 55% of girls have received vaccination at their designated age. Additional progress has been made this year in April with the decision by the Ministry of Health and the National Immunization Committee to switch to gender-neutral vaccination, which was not the case in the past, and also to introduce the latest vaccine providing broad coverage for the population. I would like also to commend for the significant step forward with lifting the age limit from the current 12, 13 to 19 years of age, which actually allows boys and girls that have not received the vaccine to receive it as part of the health insurance benefits package. And this really is a great step forward, and we look forward to scaling up the vaccination rates even further as a significant step towards eliminating cervical cancer in our country. Just also one final touch and note to give you the idea. In North Macedonia, we do not have formal sexuality education in the educational school. So all these efforts in parallel were backed with engagements with high school students on SRHR through interactive theater plays to engage them and to encourage questions and answers by health professionals and learning about the ways to protect themselves. And actually, the advancements with the HPV vaccination that were endorsed in April this year were also part of this interactive play. So informing the young people on SRHR through engaging and interactive modalities for them. As regards challenges, there were many. In anybody who is thinking about taking a similar approach, we would highlight the need to link and to work closely with the community in the field. In our case, this was the general practitioners in the rural communities who were really the key, let's say, pioneers to call and to engage their patients, women, to register and come and take advantage of the available services for cervical cancer and in general for SRHR through the mobile clinics. So only through partnerships with the help with the health authorities and of course the National Commission on Cervical Cancer Prevention, the Commission on Immunization, and the civil society and health professionals, we can really yield results. I'm happy to be in the position to share this success with you, and we hope that this will motivate others to change maybe something in the approach. And we look forward to hearing for other experiences that we could introduce in our country. Thank you.
Thank you very much, Ivanka, and again, congratulations with impressive results. I believe North Macedonia case will serve as a good example for all other countries to integrate cervical cancer prevention in the UHC. Colleagues, if you have questions, please feel free to enter these questions in the Q&A box. And in the end of country presentations section, we'll open the Q&A segment. Thank you very much, Ivanka, again. Now it's my pleasure to give the floor to our colleague, Serek Tanirbergenov, to present the experience of Kazakhstan. And this experience is very important and interesting. It's focused on adolescent health, and I believe this will be good example for other countries as well. Thank you. Sorry, the floor
Thank
is
you,
yours.
Tamar.
Thank you.
Thank you, Tamar. Good morning, good afternoon, dear colleagues. I would like to share our Kazakhstan Country Office experience about partnership with the National Ministry of Health and the government of Kazakhstan to strengthening youth-friendly health services. After several years of advocacy, our government and Ministry of Health recognized youth-friendly health services as one priority of public health system. And also Ministry of Health and our government committed at Nairobi Summit in 2019 the strengthening of youth-friendly health services. After that, Ministry of Health and UNFPA Country Office signed an agreement of the technical partnership, and within this agreement, Country Office provide a comprehensive solutions to develop and to strengthen national healthcare system. First of all, they were revising legislation to lower the age of consent to health services without parental consent from 18 to 16. After that, the direct access to youth-friendly health services without primary healthcare gatekeeping introduced in national health system. Moreover, mandatory health insurance plan covers 190 youth-friendly health services, which covers lab tests, visits to health professionals, psychological counseling, social services, and paralegal counseling. The state ensures free of charge services to all minors and students over 18. After that, UNFPA Country Office supported National Academic Society to develop curricula for medical university to raising and collecting professional capacity on youth-friendly health services. Moreover, Country Office developed the demand generation strategy to promote and advance youth-friendly health services among parental society and among young people. Next slide, please. After that, you can show at this slide, the state allocated over $35 million within National Mandatory Health Insurance Fund to provide free of charge youth-friendly health services for young people. Now, currently, the coverage of target audience is achieved 16% of young people. UNFPA Country Office supported to strengthen capacity of 1,000 health professionals, and currently youth-friendly health services provided by around 100 youth-friendly health centers across the country. Next slide, please. And if we're talking about the demand generation strategy, UNFPA Country Office supported creation the digital solution for promoting SRH knowledge and information among adolescents, young people, and their parents. Next slide, please. You can see at this slide, we developed Shin KZ digital package, which include website, mobile application, TikTok channel, Telegram channel, and Instagram account to promote this information for population of Kazakhstan. Thank you.
Thank you very much, Sarek. This is interesting story and great result achieved by the country. And I believe that our colleagues, the participants, will have the opportunity and interest to get more information about Kazakhstan's success, opening the WHO UNFPA Learning by Sharing portal. Veloshny kindly shared the link in the chat box. And of course, Veloshny will present the portal in a few minutes. And here I want to remind the countries to assess and submit their success stories, their lessons learned, to make sure that these experiences are shared with countries, and the learning portal serves as the platform for learning, but also for sharing the experiences between the countries and beyond. Thank you very much, Sarek, again. Colleagues, if you have questions, please insert these questions in Q&A box. Right now, I do not see any questions, but please feel free to add these questions later. Now it's my pleasure to give floor to our dear colleague, Veloshny Govinder, who will present very interesting material. I believe this material is important and urgent for all countries to make sure that all our actions to accelerate the processes at national level are successful. Veloshny, thank you very much for your outstanding support to our region. The floor is yours.
Thank you. Thank you so much, Tamar. And thank you to all the participants and our panelists for joining. And also, I think also a very big thank you to UNFPA for this outstanding collaboration. And I think it's a continuous learning for all of us. I will very briefly present today on some of the tools and the normative guidance that we have been developing and working on in WHO for the past several years within the context of universal health coverage. As we all know, universal health coverage is a goal under the Sustainable Development Goals, under 3.7, including UHC commitments or universal health commitments for achieving sexual and reproductive health and rights. Over the past couple of years, we've also been developing normative guidance, specifically on what should be principles for guiding improved access to universal health coverage. This would include financial protection, access to improved quality of services, and also access for extending access to different population groups. During the workshop that Tamar mentioned that was held in North Macedonia feels like a couple of months ago, but it was quite recently this year. One of the important topics, and particularly for the region, is leaving no one behind, particularly around groups that are marginalized, groups that are vulnerable. We've heard from both Sarek and Jovanka on access to services for adolescents and how within the UHC paradigm, we can improve access through removing some of the financial barriers, which both Jovanka and Sarek also noted. And importantly as well is also considerations of the legal and the policy barriers. So we need to address many of these barriers either in parallel or sequentially, recognizing that it's not only important to remove the financial, but also improve quality of care, particularly when we talk about leaving no one behind. Because some of the barriers may be interpersonal between patients and providers. Providers may have certain judgments which may obstruct access to care. And one of the starting points for ensuring universal health coverage is also to think about defining a health benefit package. We know health benefit packages have always been implicit, and all countries have a benefit package. But the focus under universal health coverage is to make those commitments more explicit, for them to be more transparent, for them to be shared with the public, for the public to know what their entitlements are, including which services they're entitled to, and what level of financial protection. What we also require and to think about when we're deciding and when countries are deciding what goes into their benefit package are considerations importantly of what is the burden of disease, importantly, which groups are being affected, what interventions are available, and are they cost effective and effective? Also, what is a budget envelope? Does the country have the resources to be able to provide those services? And if it has to choose, what should be the considerations for making those choices? And what we are also advocating for in the context of more recently the World Health Assembly's commitment and resolution on social participation is for more active engagement of civil society, youth groups, and other groups that have a stake, for whom services are intended, but should also be at the table in deciding which services will be prioritized. Some of this guidance, you'll find it's included in one of WHO's earliest documents or publications on the principles of health benefit packages, which spoke very clearly to principles around gender, around equality, around equity and access. 2 years ago, we also published the handbook on considerations and guidance to be considered when we're integrating sexual and reproductive health within universal health coverage across the policy and planning and implementation course. This would also include considerations of accountability. We have published the handbook. It's also available in Russian, and I've included a link in the chat. Can we go to the next slide, please? Thank you. There are many, many tools for supporting integration of SRH within UHC or universal health coverage priority setting processes, including defining a health benefit package. We're not going to go through all of them today. And I think, we need to also think about what do we use the tools for, what purpose? But for today, just to bring to your attention, if you have not already been involved in the development of these tools or have been presented to them at different webinars or workshops, there are 3 tools to share with you today. These tools are all interconnected. The first is the Universal Health Coverage Compendium. The compendium is a database of health services and intersectoral interventions recommended for universal health coverage. And it includes a list of over 3,500 interventions across different health areas that span the full spectrum of promotive, preventive, curative, rehab, and palliative services. So the compendium provides a one-stop access to support evidence, as well as human and material resource inputs for developing a benefit package, and is supported by WHO guidelines on clinical interventions. The UHC compendium is a living repository, which is updated as evidence and clinical interventions become available. The second tool, which builds off the UHC compendium, is the Universal Health Coverage Service Package Delivery and Implementation Tool, which is intended to support countries in developing their national health service packages. And it is a selection interface where users have access to data from the UHC compendium and can select content interventions for inclusion in national benefit packages. And it's also important in that it also allows services to be assigned to country-specific service delivery platforms. And again, with reference to the previous 2 presentations from Serik and from Jovanka, is when we're looking at access to services, it's also important not only to think about and consider what services will be delivered, but importantly in terms of geographic access, physical access, is to also consider where the services will be implemented and by which service providers. And the last tool is bring to your attention is the One Health tool, which incorporates demographic, disease burden, and health systems modules into a single platform to provide evidence for estimating costs, budgetary impact, and systems requirements. So essentially, the One Health tool is a tool for strategic planning. These tools are all related. There will certainly be more tools as well, but I think importantly for today is to bring to your attention these 3 tools, which are important in the context of defining and supporting countries in defining, as well as implementing their health benefit packages. So thank you for your attention. Look forward to any questions. And over to you, Tamar. Thank you.
Thank you very much, Volosny. Colleagues, I think these tools are extremely important, and I believe that all countries will benefit a lot by introducing and using these tools at the national level. The handbook is available in 6 languages, including English and Russian. As Volosny mentioned, please feel free to share this information to your national counterparts working in the area of health, financing, development of the health packages, both from the Ministries of Health or Ministry of Finance, etc. So I believe that these experiences and these tools will be very interesting for them as well. If you have any questions, please enter the questions in the Q&A box. I do not see the questions or comments right now. No, I see there are no questions. Or if you have any difficulties to enter the questions, please write in the chat box. Okay, so as I see, there are no questions or comments at this stage. We can continue our discussion and questions and answer session after next block, next segment, I believe. Our presenters will be online and will be happy to answer all your questions. Now we are moving to the next segment of our webinar. This is a special questionnaire to get your feedback about UHC processes and plans of the countries. Your feedback is very important. This is why we definitely need to plan our activities based on your priorities, based on your feedback. So now it's my pleasure to give floor to Timur Seyder, SRH Program Specialist at UNFPA Regional Office for Eastern Europe and Central Asia. Timur, the floor is yours. Thank you.
Thank you, Tamar. Thank you, colleagues. Yes, Tamar, you said we're slightly moving towards the end of our webinar, but before we wrap up, we would like to have some interaction with you participants and to engage in a short poll with a few simple questions. I would ask my colleagues to just to put up the poll. That, as Tamar just alluded to, will allow us to understand the extent to which the integration of SRHR in UHC is prioritized in the countries, as well as will help us to define some of the way forward in the years to come. The questions are presented simultaneously in English and in Russian, and they are very simple yes and no questions. Can I ask my colleagues to put up the poll, please? There. Yeah, so colleagues, please look at the bottom of your screen. You will see that there is a polls or quizzes with such which looks like a bar diagram on the bottom. Please click on it and you will see 5 questions as I see it right now. The first question is whether universal health coverage is a priority for your country. The second question is sexual reproductive health and rights is a priority in your country and territory? The third question is whether the normative guidance and tools presented during these webinars is relevant to your work. And would you likely to benefit from an advocacy brief to include guidance and tools for policymakers for advancing SRHR in the context of UHC? And if you scroll down, don't forget that you need to scroll down to see the last question. And it's, do you need technical support from WHO and UNFPA at the country level to advocate and implement SRHR integration? I see the responses popping out already. I don't know if everyone sees them, but it's very pleasing to see that a lot of us, like-minded people, I would say, also understand that the universality of health coverage is attained by the strong integration of sexual and reproductive health and rights in it. And it's great also to see that the majority of you, the predominant majority of you, are saying that you would likely to benefit from the follow-up actions, such as the policy brief for decision makers, to explain in relatively simple, I would say, and less technical language, the process of integration and respective tools to be employed at different stages. For me, it was, I would say, an inspiration to learn a lot of them during the workshop in Skopje, and we also understood that some of them are very elaborate and requires technical capacity, and we will be happy really to work with you in this direction. Yeah, I think we can end poll now. Yes, and we share the results of the poll. We all see them now, and thank you again for your participation in the poll. And I'm pleased to give floor back to Tamar.
Thank you very much, Timur. Colleagues, thank you very much for your feedback. It is very, very important to plan our interventions at the regional, country, and global level. So please keep us informed about your situation in the countries, about your success, about your challenges and priorities. Our teams will be happy to follow and to continue work with you. Now, I think the content of the webinar was interesting, and you will apply these tools, this information, this knowledge at the national level. I believe we achieved 3 objectives we set in the beginning of the webinar, but this work should be continued because universal health coverage is critical to deliver universal access to sexual reproductive health and to make sure that sexual reproductive rights of population is realized. Considering this, we will be happy to work with you, to get your experiences and to share your experiences on our joint portal. This is critical because knowledge exchange between countries will accelerate process a lot, will help us to achieve the results we set in the countries. Second, we believe that the tools will be used in the countries, and please let us know if you have any questions, if you need any technical support from our teams during the process of rollout and implementation of the tools. We are happy, we stand ready to provide all needed support to your countries, to your national counterparts. And we believe that all the information you received during today's webinar will be shared at the national level. We hope that many countries will mark International Day of Universal Health Coverage in 2 days. And this is one of the main reasons we wanted to organize this webinar before the International Day. So we count on your support to share these resources at the national level. And please let us know, what are your plans? What are your country-focused activities and initiatives? So let's plan together, let's implement together, and let's deliver together. Thank you very much. I'd like to express our gratitude to the speakers of the webinar, to organizers of the webinar, and to each participant of the webinar for their participation. Let's continue our work. Have a nice day. Thank you.